Welcome back to the channel where medical topics are made simple. In this video, we're going to talk about pulmonary embolism and explain the pathophysiology and causes. We cover memory tricks, mnemonics, step-by-step diagrams, all explained clearly and made easy. Pulmonary embolism is a must-know topic, and you will be tested on this. This video makes it easy, so make sure to watch the entire video. First, we have to ask ourselves, what is a pulmonary embolism or PE? A pulmonary embolism is a blood clot or other substance that travels to an artery in the lung and it blocks the artery. A blood clot traveling to the lung is the most common cause of a pulmonary embolism. But blood clots are not the only cause. Other substances can travel to the lung as well, and they can cause a pulmonary embolism. We have a memory trick to help you with this. So let's walk through the different causes of a pulmonary embolism. The causes of a pulmonary embolism can be remembered using the mnemonic FAT-BAT. This is a common mnemonic used in many resources, and it helps you remember the different causes or types of pulmonary emboli. So let's walk through this mnemonic. First, we have the F, which stands for fat. Fat globules can enter the bloodstream. This is typically from a long bone fracture or liposuction. And once the fat globules enter the bloodstream, they can travel to the lungs and block the arteries in the lungs. This can lead to a pulmonary fat embolism. So on your exams, if you see a recent long bone fracture plus symptoms of shortness of breath or chest pain, think of a pulmonary fat embolism. Next, we have the A, which stands for air. Air bubbles can also enter the bloodstream. This is typically caused by nitrogen bubbles from scuba diving or deep sea diving. If a scuba diver rises too quickly to the surface, this can cause gas or air bubbles to form in the circulation. The air bubbles can then travel to the lungs and block the arteries in the lungs. This can lead to an air embolism. When gas or air bubbles form in the blood or tissue, this is called decompression sickness or the bends. So on your exams, if you have a scuba diver presenting with symptoms, think about decompression sickness and air emboli. Next, we have the T, which stands for thrombus. This is the most common cause, so make sure you know this. A thrombus is a blood clot that forms inside a blood vessel. Unfortunately, the blood clot can sometimes break off and travel through the circulation to the lungs, and this can lead to a pulmonary embolism. This is typically from a blood clot in the legs called a DVT. A DVT stands for deep vein thrombosis, which is a blood clot that forms in a deep vein, typically in the leg. We're going to talk about this step by step shortly, so keep watching. But first, let's wrap up the last few causes. Next, we have the B, which stands for bacteria. Bacteria can also enter the bloodstream. This is typically from IV drug use, where bacteria can get inside the venous bloodstream and travel to the heart. This can lead to the formation of bacterial vegetations on the tricuspid valve, known as infective endocarditis. The vegetations can then break off and travel to the arteries in the lungs, and this can cause pulmonary septic emboli. Next, we have the other A, which stands for amniotic fluid. Amniotic fluid during pregnancy can leak into the maternal circulation. The amniotic fluid can then travel to the lungs and block the pulmonary arteries or their branches. This can lead to an amniotic fluid embolism. Finally, we have the other T, which stands for tumor. Pieces of a tumor can break off and travel through the bloodstream to the pulmonary circulation, and this can lead to a pulmonary tumor embolism. So using the FAT-BAT mnemonic, we can see that fat globules, air bubbles, blood clots, bacteria, amniotic fluid, and tumor cells can all potentially enter the bloodstream, and they can travel to the lungs and cause a pulmonary embolism. Having said that, by far the most common cause of a pulmonary embolism is a blood clot that travels to the lungs. So let's focus on this. We're going to walk step by step on how a blood clot becomes a pulmonary embolism using 3 simple steps. Step 1 is the blood clot itself, Step 2 is the journey, and Step 3 is the blockage. This will help us understand how we go from DVT to PE. So let's begin with Step 1, which is the blood clot. So Step 1 is about the blood clot itself. Remember we said earlier the most common cause of a PE is from a blood clot in the leg called a DVT, which stands for deep vein thrombosis. A DVT is a blood clot that forms in a deep vein, typically in the leg. So how does the blood clot even form? How do we get DVTs? To answer this, we can use Virchow's Triad. Virchow's Triad makes up three factors that increase the risk of blood clot formation, called thrombosis. In other words, these three factors increase the risk of developing a DVT. Let's walk through the three factors of Virchow's Triad. The first factor in Virchow's Triad is stasis of blood flow. This is when there is slowing, turbulence, or alteration of normal blood flow. For this, you want to think of long car rides, plane rides, or prolonged immobility. That's because situations like this cause the blood to slow down, pool, or develop turbulent flow patterns instead of moving normally through the vessels. So examples include immobilization, bed rest, recent surgery, paralysis, long airplane rides, long car rides, varicose veins, among others. All of these situations cause the blood to become stagnant, and when the blood becomes stagnant, clotting factors accumulate in one area along with other variables that can then lead to blood clot formation. The second factor in Virchow's Triad is hypercoagulability. These are conditions that increase the tendency for blood to clot. In other words, the blood is more prone to clotting. Examples include pregnancy, factor V Leiden, protein C deficiency, protein S deficiency, oral contraceptive use, and malignancy, to name a few. All of these conditions make the blood more likely to clot. The final factor in Virchow's Triad is vascular endothelial injury. The endothelium is the inner lining of a blood vessel. If the endothelium becomes damaged, then it exposes the underlying layers, and this triggers platelets and coagulation factors to form a blood clot. Situations that can damage the vessel wall include trauma, surgery, vasculitis, smoking, and oxidative stress from obesity, to name a few. So we can see changes in blood flow, which is stasis, changes in the blood, which is hypercoagulability, and changes in the vessel wall, which is endothelial injury, can all contribute to the formation of a DVT. Now that we know how a DVT forms, let's talk about how we go from DVT to PE. This is step 2, which is the journey. DVTs are most common in the deep veins of the legs. So how do they go from the legs to the lungs to cause a pulmonary embolism? Here's how. The blood clot in the leg can break loose from the deep vein. The blood clot can then travel through the veins in the leg and through the pelvis. The blood clot then enters the inferior vena cava, or IVC, where it travels to the heart. The IVC is the large vein that carries deoxygenated blood from the lower body back to the heart. Let's now zoom in on the heart. We can see the inferior vena cava at the bottom connecting to the right atrium of the heart, labeled RA. So the blood clot that was traveling through the IVC enters the right atrium of the heart. The blood clot then travels from the right atrium through the tricuspid valve and enters the right ventricle. The heart pumps the blood clot from the right ventricle through the pulmonary valve into the main pulmonary artery, where it travels until it becomes stuck in a smaller artery in the lung. This is known as a pulmonary embolism. As a quick reminder, the main pulmonary artery and its branches deliver deoxygenated blood to the lungs to receive oxygen. Let's review the terminology quick, and then we'll move on to step 3. This is important, so listen up. So we've talked about a thrombus, an embolus, and an embolism. A thrombus is a stationary clot that forms in a blood vessel and it stays there. So in this case, it would be the DVT that forms in the leg. An embolus is any foreign object traveling through the bloodstream. In this case, it would be the blood clot that broke off from the DVT and is traveling through the bloodstream. Remember our fat bat mnemonic. This traveling foreign object, or embolus, could also be fat globules, air bubbles, bacteria, amniotic fluid, or tumor cells. But remember, a blood clot is most common. An embolism is the resulting obstruction or event where the embolus lodges and causes a blockage. In this case, this would be when the traveling blood clot, or embolus, gets lodged in an artery in the lung and blocks it. This is a pulmonary embolism. To put it simply, for thrombus, think the stationary clot. For embolus, think the traveler. And for embolism, think the blockage. When the embolism is caused by a blood clot or thrombus that broke off and lodged elsewhere, this is known as a thromboembolism. Now that we know how the DVT became a PE, let's move on to the final step, which is step 3, which is the blockage or obstruction. The blood clot is now lodged in the arteries in the lungs. This will have pulmonary consequences, and it will have cardiovascular consequences. There are 3 main consequences to each. Let's walk through each one, starting with the pulmonary consequences. A pulmonary embolism can cause a ventilation perfusion or VQ mismatch. So what does this mean? Remember, the blood from the right side of the heart gets pumped to the lungs to receive oxygen. The right pulmonary artery delivers deoxygenated blood to the right lung, and the left pulmonary artery delivers deoxygenated blood to the left lung. Well, now we have a pulmonary embolism blocking that blood flow. Let's say the pulmonary embolism is in the left pulmonary artery. The blood will now have a hard time traveling from the right side of the heart to the left lung, and this will decrease perfusion or blood flow to the left lung. However, the patient is still breathing in oxygen, so the left lung is still getting the oxygen, but the blood is not getting to the lung to receive the oxygen. This creates a ventilation perfusion or VQ mismatch. The ventilation perfusion or VQ ratio is a ratio that compares the amount of air reaching the alveoli, which is ventilation, to the amount of blood reaching the pulmonary capillaries, which is perfusion. Simply put, it's the ventilation or breathing up top as the numerator, labeled V, and the perfusion or blood flow at the bottom as the denominator, labeled Q. When the balance is disrupted, this leads to a VQ mismatch. In the case of a pulmonary embolism in the left pulmonary artery, the ventilation is maintained because the patient is still breathing in oxygen, but the perfusion or blood flow to the left lung is decreased because of the blockage from the PE. So that portion of the lung that is blocked will have a high VQ ratio. This is because the ventilation, which is the numerator, is maintained, but the perfusion, which is the denominator, is decreased. And the left lung that has oxygen but no blood flow becomes alveolar dead space because there is no gas exchange. So instead, the right side of the heart will divert the blood and pump it through the arteries in the lungs that are not blocked. In this case, it's the right pulmonary artery. This takes us to our next consequence. A pulmonary embolism can also cause hypoxemia, which is low oxygen levels in the blood. So how does this happen? Let's use the example of the PE and the left pulmonary artery again. We just talked about how the blood will be diverted away from the obstruction, and instead it will travel through the arteries that are not blocked. In this case, it would be through the right pulmonary artery. This will cause the right lung to have an abnormal increase in perfusion. This will create another VQ mismatch, but this time in the opposite direction. We just talked about how the left lung has a high VQ ratio from decreased perfusion. Well, now for the right lung, the ventilation is still the same, meaning the patient is breathing in oxygen to the alveoli. However, the perfusion is increased. This will increase the denominator, which is perfusion, and this will decrease the VQ ratio. The massive influx of blood to the right lung moves too quickly past the alveoli, and the available oxygen in the lungs is not sufficient to oxygenate the excess blood. This means poorly oxygenated blood is returning to the rest of the body. The low oxygen levels in the blood is called hypoxemia. You can see how this will cause symptoms like shortness of breath. We're going to talk about the symptoms in the next video, which is linked down below. A pulmonary embolism can also cause a pulmonary infarction. This one is pretty easy to understand. Remember, a pulmonary embolism blocks an artery in the lung. This blocks the main blood flow to that portion of the lung, and it makes the lung tissue weak. There is also backup blood supply from the bronchial arteries, but the pressure is too much for the weak lung tissue, and the vessels can burst. This can cause the alveoli to fill with blood, and the lung tissue dies. This leads to a pulmonary infarction. You can see how this can cause symptoms like hemoptysis, which is coughing up blood. We're going to talk about symptoms in the next video. Make sure to watch it. It's linked down below. The pulmonary embolism can also cause cardiovascular problems. First, it can lead to pulmonary hypertension, which is high blood pressure in the arteries of the lungs. We know a pulmonary embolism blocks the arteries in the lungs. This will make it harder for the blood to travel through the pulmonary arteries. Think of it as a kinked hose or a blocked drain pipe. Water will get backed up and increase the pressure. The same thing happens here. The blockage causes a bottleneck, and the blood has a hard time flowing through. The fluid gets backed up, causing the pressure inside the pulmonary artery to increase. On top of that, the stress of the blockage, along with substances released by the clot, such as serotonin and thromboxane, cause the surrounding blood vessels in the lungs to constrict or narrow. The obstruction and resulting vasoconstriction increase the pressure required to push blood through the lungs. This increases the pulmonary vascular resistance, which increases the pulmonary arterial pressure, which leads to pulmonary hypertension. Now the right side of the heart has to work extra hard to pump the same amount of blood through lung arteries that are now constricted and blocked. This brings us to our next point. A pulmonary embolism can also lead to right heart failure. The pulmonary hypertension we just talked about from the PE causes the right side of the heart to work harder. Remember, the right side of the heart pumps blood to the lungs. So now the right heart has to work harder to pump the blood through a higher pressure. The right ventricle has a thin wall, and it's not used to this increased pressure, so the right ventricle begins to stretch and dilate. Right ventricular dilation also stretches the tricuspid valve open. This causes the blood to leak backward into the right atrium instead of pump forward, called tricuspid regurgitation. The overstretched and the overworked right ventricle demands more oxygen, and it compresses the right coronary artery. This causes the right ventricle to not get enough oxygen, called ischemia, and this can cause the right ventricle to fail more, which means the amount of blood it can pump forward is even less. So now the pressure in the right ventricle increases even more, which causes the interventricular septum to bulge into the left ventricle. The combination of the tricuspid regurgitation, the right heart failure, the interventricular septum bulging into the left ventricle, along with the PE obstruction itself, all cause the left ventricle to receive less blood. This takes us to our final consequence, obstructive shock. A pulmonary embolism can also cause obstructive shock. We just talked about how a PE can cause the right heart to fail. This can lead to the left ventricle receiving less blood. This can then lead to a decrease in the amount of blood pumped out of the heart, called stroke volume. If stroke volume decreases, then this can decrease cardiac output. And if cardiac output decreases, this can decrease blood pressure. We can combine this with the hypoxemia we talked about earlier. The decreased blood pressure, along with the hypoxemia, can lead to decreased oxygenated blood delivered to tissues and organs. This can lead to shock, which is where the cardiovascular system fails to deliver enough oxygenated blood to satisfy the metabolic demands of tissues and organs. A pulmonary embolism is a form of obstructive shock, which is a physical obstruction blocking blood flow out of the heart. So we can see how there is a progression from a pulmonary embolism to increased pulmonary vascular resistance, to pulmonary hypertension, to right-sided heart failure, to obstructive shock, and we can see how both cardiovascular and pulmonary consequences can lead to symptoms such as shortness of breath and chest pain. We're going to talk about symptoms and diagnosis of PE in the next video, which you can find linked down below. If you found the video useful, please hit that like button and let us know in the comments. You can find the notes for this video, along with our book and flashcards linked down below. Subscribe to save time studying and not miss out on future videos and notes. Thanks for watching, and hope you return for future videos.